Thank you for your interest in wanting to learn more about the changes to the Child Care Assistance Program. The changes to the program represent a paradigm shift for child care in Iowa. This webinar will provide information about the reasons for the changes, when the changes will happen, and provide an overview of each program change. In November 2014, Congress passed and President Obama signed a federal legislative bill into law reauthorizing the Child Care and Development Block Grant. It had been almost 20 years since this block grant was reauthorized. In the new law, there are several changes states must do as part of the state's Child Care Subsidy Program. In Iowa, our Child Care Subsidy Program is called the Child Care Assistance Program. In the webinar, I will also refer to the program as the CCA program. The new law makes significant advancements focused on strengthening child care across the United States to better support the success of both parents and children. The changes balance the goals of promoting children's healthy development, safety, and school readiness, while also supporting parents who are working or in a training or education program through family-friendly policies. States must implement the new federal law by September 30th of this year. The changes in the new law include moving from a 6-month to a 12-month certification period, allowing for temporary changes in work, training, and education activities, allowing more time for job search activities for families currently receiving child care assistance, providing an exit program, and creating a tiered payment rate structure for providers. I will share more information about each of these items shortly, but I want to first tell you when the changes will be effective in Iowa and share a little more background information. Iowa will implement the changes to the Child Care Assistance Program on July 1st. The July 1st date is before the required federal deadline for implementing the changes. The Child Care Assistance Program has always been a work and education training support program for parents. The new law also takes into account the needs of the child. In the next few slides, I want to share information about current investments in the Child Care Assistance Program and what we know based on research in child development, which is one reason why the new law considers the needs of the child. A significant amount of federal and state dollars support the Child Care Assistance Program. In state fiscal year 15, which was from July 1st, 2014 to June 30th, 2015, Iowa spent $101.4 million in state and federal funding for the Child Care Assistance Program. In state fiscal year 15, there was an average of 21,205 children on the Child Care Assistance Program. When we look at enrollment data trends, the number of children enrolled in the program has decreased in the last several years. Of the families enrolled in the program, 94.7% of the parents were employed. The CCA program in Iowa is a safety net benefit program that supports parents working in low-wage jobs and are going to school or in a training program. Besides the federal and state investments in the CCA program, there are additional state and federal dollars used to support quality child care initiatives in our state. This slide only provides data on the dollars invested in the Child Care Assistance Program. We've learned a lot about how children's brains develop and the importance of a child developing trusting relationships with caregivers, such as parents, extended family members, and child care providers, since the first law was passed in 1998. In the first few years of life, there are 700 new brain synapses that happen per second. The synapses connect the neurons in the brain. The brain is built in stages, with more complex structures built on simpler structures. So it is important to get it right from the beginning. As you can see in the brain scan photo of a newborn, there are very few connections between the neurons compared to a 9-month-old child. The strength of those connections depends on the caring relationship the child has with caregivers. Think about the children in your care. What is the average amount of time you care for a child each day? Let's do the math for the 700 new brain synapses that happen per second in those first few years. If the parent drops the child off with you at 8 a.m. and picks the child up at 5:30, that child's brain has changed in almost 24 million ways while in your care. The picture in this slide shows the different functions that develop in the brain. As you can see, in the first few months of life, vision and hearing development peaks. Next, in the first year, language development peaks. That is one reason why reading and talking to infants is very important. The last function to develop is higher cognitive function. This is often referred to as executive function and self-regulation skills, which impact school achievement, positive behaviors, good health, and successful work. A caring and nurturing early learning environment helps young children develop social and emotional skills, which is the foundation of executive functioning and self-regulation. When a child is treated with care and respect from a consistent caregiver, the child forms a trusting relationship, which fosters curiosity, courage, initiative, empathy, a sense of self, a feeling of belonging, and independence in a child. In the last two slides, we looked at brain scans of the connections between the neurons at different periods of time and the different functions that develop in the brain. The picture in this slide shows the percentage of the brain's development at different ages. At birth, 25% of the brain is developed. At age 3, 85% of the brain is developed, which is before the child goes to preschool. If we look at age 5, when the child starts kindergarten, 92% of the child's brain is developed. The care you provide to children as part of your child care business plays a critical role in building better brains in children. If you want to learn more about brain development, both the Harvard Center on the Developing Child and iLabs at the University of Washington have additional information and videos. Iowa Child Care Resource and Referral can also provide additional resources. Besides the changes to the CCA program, the new federal law also establishes that states must have a minimum level of monitoring and requirements for child care providers, specific health and safety trainings for child care providers, pre-inspections for some categories of child care providers, and consumer education information available to parents, such as child care provider compliance and complaint report, and information about child development. All of the changes are to reduce the gaps in health and safety in child care settings, from state to state, to help protect children. If you want to learn more about the changes in law based on your child care provider category, you can access recorded webinars on the DHS website. Now that I've provided a little background information, let's take a look at each change to the Child Care Assistance Program. The change from a 6-month to a 12-month eligibility before the family must have their program eligibility redetermined has a positive effect on families. The family can remain eligible for the program during the 12-month period regardless of changes in income, as long as the family's income is below 85% of the state median income, and regardless of temporary changes in the parent's work, education, or training status. I will provide more information about what is considered temporary changes shortly. Also, I will share information about the state median income when I talk about the CCA Plus Program. The length of the certification period is significant for the child, the parents, and your child care business. The 12-month program eligibility period provides continuity of care so the child can remain in the same child care environment. With the 6-month certification period that is currently what we have in Iowa, some children frequently cycled on and off of the child care assistance program. I will share, as I shared in an earlier slide related to brain development, a stable, safe, and nurturing child care environment helps young children develop trusting relationships, which in turn strengthens the child's social and emotional skills that affects executive functioning and self-regulation skills. The 12-month certification period also allows more time for the family to become financially stable. And last, as a provider, the 12-month eligibility period provides consistent income to support your child care business. There will be a transition period to move families from a 6-month certification period to a 12-month certification period. The 12-month certification period begins July 1st. So a current 6-month certification period does not automatically change to a 12-month certification period. Beginning July 1st, when the 6-month certification period is ending, DHS will process the new renewal application for a 12-month certification period when the family meets program eligibility criteria. If a DHS worker processes and approves an application or renewal before July 1st, the certification period is for 6 months. If the worker processes and approves an application or renewal on or after July 1st, the certification period is for 12 months. Let's take a look at some examples. So the first example is an application received on June 2nd and processed on June 23rd of 2016. For this application, the family would receive a 6-month certification period that would go from June 2nd, 2016 to December 1st, 2016. In the second example, the application was received on June 2nd and processed on July 1st. Since it was on July 1st, the application would be for a 12-month certification period approved for. It would run from June 2nd, 2016 to June 1st, 2017. The third example is an application received on July 1st, 2016 and processed on August 5th, 2016. This application, once approved, would receive a 12-month certification period going from July 1st, 2016 to June 30th, 2017. There are a couple circumstances when the certification will be for more than 12 months. One example is when a child will turn 13 years old within a couple months of the 12-month certification period. In this example, the DHS worker will extend the certification period to the date the child turns 13. If during the certification period the parent has a temporary change in work, education, or training activities, the family can remain on the Child Care Assistance Program. For the CCA program, a change is considered temporary if it is not expected to last more than 3 months. Some examples of temporary changes include maternity leave, Family Medical Leave Act, or FMLA, for household members, participation in a treatment or rehabilitation program, employment or training hours that fall below the required minimum, and normal breaks between school terms. Let's talk about one type of temporary change. The parent is a student and has a break between Christmas and New Year's. Since this is a temporary change, the child will remain on the Child Care Assistance Program, and the number of child care units the family is approved for remains the same as when the parent attended classes. So if the family was approved for 2 child care units on Monday, Wednesday, and Friday, and 1 child care unit on Tuesday and Thursday, the family is still approved for the same child care units during the school break. If the family's child care assistance includes a parental fee, you will continue to collect the parental fee when there is a temporary change in the parent's work, education, or training. Remember, allowing for temporary changes begins July 1st. For families that will be, for many families, there will be changes in the parent's work, training, and education activities during the 12-month certification period. DHS wants the parent to continue to report changes in work, school, and training to us. Again, based on the changes to the CCA program, the family still remains on the program when there are temporary changes. Also, your child care business can bill up to 4 days of absence in a calendar month for regularly scheduled days the child was not in attendance. The total number of days you can bill DHS for days of absence in a calendar month is not changing. If the parent temporarily loses his or her job during the certification period, the parent is allowed up to 3 months for job search activities to return to employment. Under the current program, the parent receives currently 1 month of child care, and DHS determines the number of child care units to approve for job search activities. Based on the new federal law, the parent is no longer required to submit job search documentation to DHS. The number of child care units the family is approved for remains the same as before the parent lost his or her job. If the family's child care assistance includes a parental fee, you will continue to collect the parental fee when the parent is unemployed and completing job search activities. I also want to mention that if the parent is currently unemployed when applying for child care assistance, the family meets other program eligibility criteria, DHS will approve 30 days for job search activities. This policy and procedure remains the same with the new law. Families that are at or below 145% of the federal poverty level are eligible for the Child Care Assistance Program. Beginning July 1st, if a family is over the CCA eligibility limit of 145% of the federal poverty level when completing the renewal application and below 85% of the state median income, the family can still receive child care assistance for up to 1 year as part of an exit program if the family meets other program eligibility criteria. This program is called CCA Plus. Let's take a look at an example. For a single-parent household with 2 children, the family's gross monthly income at 145% of the federal poverty level is $2,436. 85% of the monthly state median income for the same family of 3 is $4,718. If the family's income is between these two dollar amounts and the parent in the household and child meet all other program eligibility requirements such as work hours, a full-time student, the age of the child, etc., the family is eligible for the CCA Plus program. In response to the new federal requirements for a tiered payment structure for higher quality child care programs, DHS will pay QRF Level 5 providers at the 75th percentile of the 2014 market rate survey. If you are not familiar with how payment rates are determined, let's walk through a basic example. DHS conducts a market rate survey every 2 years. When conducting the market rate survey, DHS received child care rates for 100 child care centers in Iowa. We make a list of the rates from lowest to highest. Next, we go to the rate that is number 75 in the list because we want the 75th percentile. Remember that our list has a total of 100 rates, so number 75 is the 75th percentile. That rate is then identified as the Child Care Center state payment rate based on that particular year's market rate survey. Next, when setting up the Child Care Provider Agreement, DHS compares the provider's private pay rate against the maximum state payment rate and pays the lesser of the two rates to the provider. DHS recognizes that QRS Level 5 child care providers for centers and child development homes are one measure of quality. Nationally accredited child care facilities such as NACI and NASCC is another measure of quality. The cost for implementing the new federal law will far exceed the minimal additional dollars Iowa will receive in federal child care funding. In the first few years of implementing the new federal law, Iowa must proceed cautiously and monitor expenses. DHS will review the tiered payment rate structure as we monitor the implementation of the new law. In addition, Iowa's quality rating system is currently under review and being revamped into a quality rating and improvement system, or known as QRIS. In the updated version, nationally accredited facilities and facilities meeting Head Start standards will have an abbreviated process for participating in the QRIS. DHS will implement QRIS in state fiscal year 2017. This slide has two payment rate tables. For child care centers and child development homes, the current payment rates are based on the 75th percentile of the 2014 market rate survey, plus 2%, plus 2%, plus 4%. The Iowa legislature sets the payment rate. For non-registered child care homes, the payment rates have remained unchanged for several years. The bottom table represents payment rates for the 75th percentile of the 2014 market rate survey that DHS will pay QRS Level 5 providers. The new federal law uses what we know based on child development research to improve the quality of child care environments by being child-focused, family-friendly, and fair to providers. On behalf of the Department of Human Services, I want to thank you for providing care to children on the Child Care Assistance Program. If you have questions about the Child Care Assistance Program, contact the Centralized Child Care Assistance Payment and Registration Unit at 1-866-448-4605. To help parents understand the changes to the Child Care Assistance Program, we have recorded a parent-specific webinar. A link to the recording is available on the DHS website. If you care for a child on the Child Care Assistance Program, please share information about the recorded webinar with the child's parents. Last, I want to mention that there is a frequently asked questions document available on the Iowa Child Care Resource and Referral website that may answer questions you have. Also, to get the latest updates, information, and resources available, I recommend that you sign up to get emails from the Child Care Resource and Referral. Contact information can be found on their website at www.iowaccrr.org or by calling 1-877-216-8481.